I'd like to take the opportunity to welcome everyone to the special session of JCPA's Delegate Assembly. I'm Mike Fromm, JCPA's Board Chair, and on behalf of our entire board, I want to thank you all for making the time to participate in this important meeting. It's times like this that JCPA and the entire community relations network is at its best, advocating for and mobilizing the Jewish community to tackle pressing issues that arise during emergency situations at the local and national level. We know that many of you are busy with local demands, and we hope that this assembly will help to support your efforts. In the interest of time, we won't address issues like anti-Semitism, hate, and bigotry during this session, as we have robust policy on and already working on those concerns. This is the first time that JCPA is bringing this assembly together virtually. We hope the technology will work as planned, but please bear with us if we experience a few difficulties, with almost 200 people having registered for today's meeting. We will not be able to see each other, but it's important that you're all here and participating. We have an important agenda that we want to cover with the allotted time, so I'm going to ask David Bohm, who introduced the session, who is JCPA's Policy Advisory Chair, to officially bring the Delegate Assembly to order and begin today's program. Thank you very much.
Thank you, Michael. The purpose of this special session of the Delegates Assembly is to learn about the issues that are arising around COVID-19, where JCPA does not have existing policy or has what we believe to be inadequate policy, and seek guidance from this body on whether or not we should be adopting new resolutions in order to stand with our coalition partners on important legislative requests, and also be prepared for emerging issues that are arising. Delegates Assembly is the highest deliberative body on public policy in the community relations field, and JCPA carries out the policy that is adopted by our resolutions. Four areas that we will be discussing today are the Jewish safety net, elections and voting rights, criminal justice reform, and immigration. During the first 2 hours, we will hear from featured issue experts on the topics, and in the last hour, we will meet in issue-focused breakout groups to delve deeper into these issues and to make recommendations to JCPA on the policy development. During the presentations, your videos will be muted. To participate in the breakout groups, you need to have signed up ahead of time. This is important as the Zoom technology that our technical support staff, and particularly Haya, has to place each of you in a room. If you're planning to stay and haven't yet filled out the form that was sent to you, please go to the chat box and send a personal note to Haya, letting her know which breakout group you want to participate in, or send her an email prior to 1:45 p.m. Eastern Time. Haya's email address is hluftig@thejcpa.org. We're putting it in the chat box now. At the end of the session, we'll return to the plenary for very brief report backs from the breakout groups. I want to thank the other organizers of this program, in particular, Corey Shapiro, Susan Abravanel, Melanie Roth-Gorelick, and the rest of the JCPA team. For each speaker, we will only provide brief bios, but you can get more information on the speakers at JCPA's website. And I'm going to turn the program now over to Susan Abravanel. Before I do, I want to remind you, please mute yourself and please turn your video off.
For a walk with the dog.
Unless you're a speaker or presenter. Okay.
Thank you, David. Our first issue today deals with safety net concerns and the Jewish community. While no new policy is really needed at this time, we do feel it is important to focus on how the pandemic has impacted the Jewish Federation and human services agencies. This is a priority focus of our advocacy, as well as where our challenges are at this time. During our breakout groups, we will be engaging in the development of a JCPA resolution on the pandemic, as well as exploring the other issues. Our two speakers today in this first session are Reuben Rotman, the CEO of the National Jewish Human Services Agencies, and Stephan Kline, Interim Director of the JFNA Washington office, who has been at the helm of advocacy on the JFNA response to the pandemic. Please see your background materials for more bio information on these and on all of our speakers today. Due to time constraints, we're not going to have a formal Q&A after this session, but you can place your questions in the chat box and we will respond to you by email following today's presentation. I'm now turning this over to Ruben Rothman, and I'm pleased to welcome you to this session.
Thank you, Susan. Thank you, everybody, for joining. So when JCPA reached out, when Melanie reached out and asked me to present, we thought it made sense to give you first a general overview of what the impact has been, and then I will speak specifically about some advocacy-related efforts that have risen to the front as needs have been identified. First, I think it's important to note that the agencies that I'm speaking about are both community-based Jewish family service or vocational service agencies. They're domestic violence programs, they're kosher food pantries, they're elder care agencies, but I will also speak about the unique needs of the nursing home agencies in our systems and Jewish senior living communities, as well as Jewish residential communities. All of these have been dramatically disrupted by the coronavirus dynamic and crisis. I think the first thing to note is that traditionally, these agencies operate on an in-person basis, meaning services are provided directly to individuals on a face-to-face basis. And as a result, the government funding that often is meant to support those services are reimbursed to agencies on a per-person, face-to-face contact basis. As most, with the exception of residential providers, as most of our community-based agencies have needed to close those face-to-face programs and have needed to transition literally almost everything that they do to virtual platforms like Zoom and other HIPAA compliant platforms that allow for confidentiality. The agencies have needed to think on their feet, to think very quickly, and as you could imagine, government has been uneven in its ability to keep up with the transformation. There are some states that have had great flexibility and have transitioned funding structures so that the face-to-face activity can now be reimbursed virtually, and there are other states where that has not happened. So I think the underlying key that we've been striving for when we think about advocacy in DC and on a state level is the need for flexibility. As we've learned more about the virus and the implications of providing human services in a safe and responsible manner in the context of the virus, our agencies have needed to be flexible in how they do so. So one example, kosher food pantries now, traditionally, the best practice method is that an individual would literally go shopping, and there would be a great deal of personal choice involved in selecting food to meet their own personal needs, their preferences, etc. Our agencies don't have the capacity, because of social distancing, to allow the personal shopping to take place any longer. So instead, packages are being pre-assembled, and in most cases, they're being left outside of the physical structure, whatever the food pantry operates. In some cases, they're being delivered by drive-by food pantries. In many cases where volunteers are involved, they're delivering and dropping in lobbies of buildings, of apartment buildings, or outside the front door of the older adult or the person in need. All of that is very, very dramatically different. In addition, our congregate nutrition sites have all been asked to close. And so what's happened is that states and agencies have needed more flexibility in moving those dollars from congregate funding to home delivered or Meals on Wheels funding. So I'll just touch on a few areas where flexibility has been needed. The first in the realm of telehealth. Our agency is now providing services, mental health counseling and vocational counseling services via remote or virtual platforms. Medicare and Medicaid in particular, again on a state, Medicare universally, but Medicaid on a state-by-state basis, have allowed for those services to be provided via telehealth, but the platform has to be both audio and video. Our agencies provide services to many clients who do not have a computer, who do not have access to the internet, who, if they have a computer, may not be comfortable or know how to operate the technology. And so we've been advocating for telehealth to also include telephone. I believe that there's been some movement on that, and we're going to see that change, but we're not universally there yet consistently. Another has been in SNAP. Supplemental Nutrition Assistance Program provides assistance as needed for people that need those extra dollars or resources to purchase food. And while the phase 2 stimulus package did allow for more individuals to be covered under SNAP, it did not increase the benefit, the actual amount that each individual can use with SNAP. And again, for social distancing, SNAP dollars generally are not available on a national basis to be used for home delivered services. And so those individuals who depend on SNAP are being asked to go to stores in most states. And again, in most states, when they go, many shelves are bare, and there are limitations on what they can purchase. So again, we're advocating for flexibility, both in terms of the amount and in terms of being able to use that resource for home delivered or delivery. And the last area I'll just touch on, I mentioned earlier, is the need for flexibility between congregate and home delivered. Traditionally, many government funding sources are very specific. The funding is available for the very focused service. So if it's a congregate site, that's all it could be used for. But now with congregate sites being closed, we've asked for those dollars to be transitioned to home delivered. That area of flexibility is something that government, again, we're not getting the consistent support. Sometimes some states more flexible than others. So with that, I am going to turn it over to my partner, Stephan, who has some more background and detail to add.
Thanks, Ramid, for your great overview. So I wanted to start both with a micro point and then macro point, and then also get into the advocacy. The micro point is tonight Yom HaShoah starts, and it's tomorrow. And we learned this morning at a program that we convened for my colleagues at JFNA that just on Friday in an unscientific survey of about 15 of our social service agencies that we work with through the Center on Advancing Holocaust Survivor Care, those agencies reported that 37 Holocaust survivors had died because of coronavirus, none of them in nursing homes. There's going to be more of them, and we know that. We know that, that in fact, the very first victim of coronavirus in Israel was a Holocaust survivor. It's not surprising that Holocaust survivors who are elderly and traumatized and frail would be disproportionately affected by this disease. But today on Yom HaShoah, we need to specifically commemorate it. Ruben did a job of talking about the range of issues in the network of Jewish human service agencies and our partners, and how they're responding to coronavirus and the specific concerns that they have. This, however, is much broader in the Jewish community, and you all know this about the work that you're doing. Our agencies, besides having to respond to the needs of the clients that they serve in such a visceral and dramatic way, also that their very survival is at stake. We know that a number of agencies have had to lay off staff that are serving these vulnerable people, that would, or to furlough others, or to figure out how to minimize costs over the next couple of months because of this. And that's obviously not just in the Jewish human service sector, but it's impacting Jewish community centers, some of which are really close to the financial edge, or our synagogues, or the other institutions that we serve. I heard of a federation on Friday that just laid off more than 20 staff people because of the economic crisis caused by this public health calamity. So when we talk about the human service implications, we're talking not only about the services that we need and the services that we need to do differently to serve.
Did you conclude?
Thanks. So we're talking not only about the services that we need to provide differently, but also we need to safeguard the institutions that are providing the people that are doing these services. And later, when we think of the resolution, we need to say that, of course, that the needs of the most vulnerable need to be paramount. But this, of course, is a disease and a public health catastrophe that is affecting everyone in our communities. So that's the macro. Not surprisingly, when we talk about advocacy, Ruben pointed to the issues that we are caring most about in our advocacy in the next stage of Congress's response to coronavirus. There have been 3 bills, as you know, throughout May that responded to parts of this. There'll be a 4th interim bill today, tomorrow, Wednesday, at some point this week. And then there'll be a much broader piece of legislation, we think, in early May. And besides the nonprofit issues like the paycheck protection, which you've heard so much about, Ruben pointed to many of the things that we're going to focus on. But one that is probably even more important than those is more support for Medicaid funding. There was support for what's called FMAP, the Federal Medical Assistance Percentage, in the Family First coronavirus bill, but more is needed. That was a 6% increase in Medicaid funding, and we're advocating for another 6% in this next bill. Without that, we can't do any of the other funding changes that we need that cost money, whether it's the telehealth issues or the funding for danger pay or overtime in residential facilities that have extra costs due to coronavirus. So this is, in fact, what we think is the most important of the health and human service funding issues, although we're going to be pushing for all of them. So I'm going to stop there, but I look forward to working with you to advance these issues in the next weeks and months. Thanks.
Thank you both so much for your informative presentations and your leadership during this very challenging time. I know I picked up a couple of pointers from both of your presentations that need to be incorporated into the pandemic resolution that we're preparing. We're going to be discussing these issues further in the breakout session on the pandemic later this afternoon. Before I turn this over to Corey, I just want to issue a brief reminder. Some of you are still showing your audio and video. Both audio and video need to be turned off unless you happen to be the speaker, please. Thank you very much. Corey, I'm turning the program over to you. Corey, you need to turn on your audio and video.
Actually, maybe Melanie can, this is Bruce Turnbull. I think the program got shifted so that I think the criminal justice is next.
Okay, good. Bruce.
Okay. Hi, everybody. I'm Bruce Turnbull. I'm the co-chair of the JCPA Criminal Justice Initiative, along with Faye Taxman. And we wanted to talk today a bit about the challenges in the criminal justice system that have been presented with the coronavirus situation. You can easily imagine that a jail or a prison or for that matter, an immigration detention facility can be overcrowded, can offer less than perfect, and in many cases very bad hygiene facilities and capabilities, and can therefore expose the people who both reside in those facilities and the workers who come in and out to work with them to situations that are not what we're supposed to have in this era of social distancing and isolating people who have the virus. And so we wanted to get a little bit more depth on that from a couple of speakers, and then I'll come back and talk a bit about how this fits within, or where the tensions are with our existing resolutions. So I'm going to turn first to Insha Rahman, who is Director of Strategy and New Initiatives at the Vera Institute of Justice. Insha is well known to us, having worked with JCPA on some initiatives. She also appeared at on a panel at our conference in February, and is really an expert in this area. And so we're going to hear first from her, and then from my co-chair, Faye Taxman, who is, apart from her activities with JCPA, a professor at George Mason University in criminology, and is an expert widely regarded, and has published over 190 articles, has received numerous awards. And so she is an expert as well. And then we'll come back, as I said, with me, talking a bit about how this all fits within our resolution process. So Insha, if you're there and ready, I'll turn it over to you.
Great. Thank you so much, Bruce. And thank you to all of you, first of all, for taking time to join this meeting in what is an unprecedented time for all of us, and specifically for paying attention to a number of issues. It was interesting for me to hear the last presentation, and the fact that you're paying particular attention in this time to criminal justice and how coronavirus has really impacted the normal proceedings in our courts, our jails, our prisons, for people on probation and parole, for people in the immigration system as well. And so I just want to do a little bit of framing for what is the sort of challenge right now with coronavirus and our criminal justice system, and what might JCPA be able to do above and beyond the great resolutions you already have and your commitment to this work to perhaps do more in this moment, to be able to put out statements and do work at the local level to respond to this crisis. So we're living in an extraordinary time, and the ordinary responses to the criminal justice system, including ordinary reforms such as bail reform or reforms to how we do probation and parole or sentencing, they're not nearly enough to address the pandemic sort of within a pandemic, which is coronavirus in our courts, our jails, our prisons, our detention facilities. Some of you might have seen the news last week that was very welcome, that the federal government agreed to release hundreds of prisoners who are in federal facilities to respond to the pandemic and to sort of thin the numbers of people behind bars, and especially release people who are older, who are immunocompromised, who are especially vulnerable to the infection and the complications as a result of infection. That's a great first step, but that is not nearly enough, given that the federal system and who is in federal prison is only a tiny proportion of the 2.3 million people in jail and prison in this country right now, and just the sort of overwhelming numbers of folks who go through the criminal justice system. And so I'm just going to throw out some statistics so you get a sense of sort of the magnitude of the problem. Each year there are about 10.4 million arrests that happen in this country. There are almost 11 million admissions to jail. And on any given day, we have a little over 1.5 million people in prison and another 750,000 in local jails. And so those are some tremendous, tremendous numbers. And all of those settings are congregate settings. We've been talking about nursing homes and how people are especially likely to contract the virus and to have really serious consequences as a result because there's no ability to do social distancing. Well, the courts and jails and prisons are exactly the same. Just to paint a picture of what that looks like, literally you can imagine being moved from your dormitory where you sleep within 2 feet of another person. You know, you're moved sort of in a row, 500 people at a time, to the mess hall for food, or to the showers and the toilets, all of which are shared spaces. There's no such thing as being able to do social distancing or any of our best practices to respond to coronavirus within jails and prisons. And so what we have seen is that we need to do essentially 3 things. And these are extraordinary measures because, again, this is an extraordinary time that we live in. The first thing is to simply just reduce the flow of the number of people who come through the criminal justice system in the first place. And we've seen local police departments, sheriff's departments, law enforcement dramatically reduce arrests during this time and say, look, if we don't need to make an arrest, if this is you know, something like driving with a suspended license or just having, you know, a little bit of marijuana. These aren't public safety concerns necessarily. There's obviously conduct we don't like, but we don't need to arrest somebody and put them through the system right now, you know, to just sort of keep the folks out of the system who don't need to be in it. Another thing is to reduce prosecution and to not use bail as much as we've historically done, again, to keep people out of jail and prison, and to really sort of give ourselves a chance to say, for the folks who, you know, do end up there in jail or prison, how do we make sure that we have more of a chance to sort of do all of those protective measures? And so on the front end, one of the big opportunities for us to really reduce the flow of people into the criminal justice system in the first place. The second measure that we're seeing places across the country do is to simply reduce the number of people who are in jail or prison. And what we've seen is that there's been a lot more success at the local level with jails, where it's really the decision of prosecutors and judges and public defenders to say, look, can we figure out how to sort of release some people who pose no threat to public safety, but they're simply there because they can't afford their bail, or they're serving a short sentence on an offense and we actually feel comfortable resentencing them to time served so that we, again, get them out of jail and create more opportunity for space and social distancing. The bigger challenge has been at the prison level. You know, each state has its own local prison system. And in order to release people who are in prison, who are there serving felony sentences of a year or more or less, that's generally sort of what distinguishes people in prison versus jail. It actually is under the purview of governors to make decisions to say, we're going to release people early, we're going to release people who are medically vulnerable, we're going to release people who are older in prison. And so we've seen some movement there. We saw Governor Andy Beshear of Kentucky release a significant portion, 7% of the population in response to coronavirus. We've seen commitments from other governors like Gavin Newsom of California to release some people, but the sort of momentum has not been the same as on the local county level in jails, where we've seen some counties literally reduce their jail population by 25, 30, 40%. In response to coronavirus. And one thing I think is really important to mention is, I think oftentimes the fear of releasing a lot of people or keeping people out of the criminal justice system and not making an arrest is, will this impact public safety? Will there be a sort of uptick in crime as a result? And we've certainly all seen headlines of 1 or 2 outlier cases. There was a terrible case in Florida just a couple of days ago. The New York Post here in New York City wrote a piece about how some people released from Rikers Island, you know, were rearrested shortly after release. But I want to point out that those numbers are outliers, and they're a very, very small fraction of the overall percentage of people who've been released who, you know, if you think about turning the numbers on their heads, that's that many more people who we have saved from coming into contact with the virus, from really straining not only the medical system within jails or prisons, but also in our communities. Because the most important thing to remember is that jails and prisons are not contained sort of closed, places. This virus doesn't respect walls, as we know. And so what we see is because jails and prisons have staff who come in and out daily, they are bringing this virus, if there's an outbreak in a jail or a prison, back to their communities. We're doing more testing of staff who work in jails and prisons. And so what we're seeing, for example, in Rikers Island is over 600 corrections staff have tested positive. Over another 400 people who are incarcerated there have tested positive. And those are, again, only the known cases. And to put that into context, over 1,000 people, there's only 4,000 people at Rikers Island who are incarcerated in the first place. So we're really looking at a rate of infection and spread that is just devastating already. We've had 3 deaths at Rikers Island of people who are incarcerated and a couple more deaths of staff who work there. We will see this again and again and again across the country unless we do something in this moment and really think of public health as being connected to public safety in this moment. And then the third thing, I talked about sort of stemming the tide of people coming into the system. The second thing being releasing people from jail and prison. And the third most important sort of extraordinary response in this moment is making sure that for people who remain incarcerated, that there are proper measures for social distancing, for personal protective equipment, and also for medical care and medical isolation of people who are infected. Again, the reason to invest in doing this in our jails and prisons is not only for the health and safety of the people incarcerated there, but for the larger community as well, because we know this, wherever we've seen a serious outbreak of coronavirus, it's really taxed local healthcare systems and hospitals. There aren't enough respirators, there aren't enough hospital beds. No jail or prison has the kind of medical equipment needed to handle a serious case of coronavirus. Those folks who are impacted will end up in our local community hospitals, which really taxes the system for everybody, which is why prevention and isolation is so important, but to do so with dignity so that we're not relying on solitary confinement or other more punitive measures to actually respond to a medical issue. So I will stop there and turn it over to my colleague, Faye Taxman, who I know is going to focus on specifically the need for a different response to supervision, probation, and parole, given the spread of coronavirus. So Faye, if I can hand it over to you.
Right, thank you very much. Good afternoon, I'm Faye Taxman. As Bruce said, I'm co-chair of the Criminal Justice Initiative here. And I'm really pleased to be here today and also recognizing the extraordinary times that we're in. So we've already pretty much covered prisons and jails. I want to focus our attention on the probation and parole population, because this is a population that is almost invisible, but yet it has high significance in this particular time that we're in, as well as in general for criminal justice practice. So probation typically, which is the first step in the type of criminal justice responses. It's also the step that is most likely to lead to further incarcerations because people who don't do well under the very steep conditions that we have for people under probation and parole. So just so you're aware, there's almost 6 million people on probation and parole in the US. The majority are on probation, which means that they do not have as extensive of a criminal career and have had less time in prison. They may have spent some time in their local jails. Probation and parole, as we deliver it today, is has very high standards, usually 17 or more conditions or standards. It's a contact-driven environment, coming to see your probation officer, getting drug tested, paying fines and fees, engaging in all sorts of other sort of contact activity. And obviously in this period of time with COVID, we have to really change our practice. Now, the caution here for us right now is in the past, we've always looked at probation and parole as being lightweight, not enough of a punishment. Hence why we've stacked up for people over the last couple of decades, the number of conditions and requirements, and those conditions have actually had an adverse effect of causing more people to recycle through the justice system. So we can look right now at some innovations that kind of fit the same line of reducing the number of people, supervision, reducing the contact that people have, and also dealing with the vulnerabilities of this particular population. So for example, about 30 to 40% of the people on probation and parole are classified as, in the criminal justice lingo, it's called low risk. People who don't have a high probability for coming back in the criminal justice system. This is a good population that we can begin to think of alternatives to probation and parole that actually reduce the degree to which they're involved in the justice system. Another key issue is this issue about reducing contacts. Most probationers have to see their probation officers, and probation systems right now are moving to telehealth models of contact and texting and other forms of trying to stay in contact with people. These are great innovations. New York City many years ago showed with a kiosk system that for low-risk offenders that could be an effective way of reducing the demand on the justice system, but also, you know, making sure that people are held to the conditions of supervision. And so we have to be open to these reductions in face-to-face contacts as a way of dealing with this population. And then last, I want to deal with the vulnerabilities of the population. So just as our speakers who initiated this conference basically talked about, you know, we have a lot of people in our society that are hungry, that don't have a proper place to live, that don't necessarily have enough social supports to maintain their own dignity and also their safety from COVID and other infectious diseases. So within our probation population, you can imagine that this is a higher rate of you know, people with housing needs, people with food insecurities, people who need more resources for basic living. And therefore, and those actually are risk factors that can, or in terms of not doing well on probation supervision. So as we think about this notion about, you know, what should we be thinking about doing with the probation and parole population, it's not just rehabilitation as much as it is helping to make sure people are safe and secure and that they have the basic necessities of life so that they can be socially isolated to prevent the you know, spread of this particular virus and the infection overall. So I encourage you to really think about the fact that this is an area in which there's a tremendous need for us to deal with people in much the same way that we need to deal with folks who are, you know, on other types of social welfare systems. And I know we're short of time, so I'm going to turn it back over to Bruce for the rest of this particular discussion.
Thanks, Faye, and thanks, Insha, for your presentation. I will note for people that Insha has posted a couple of things in the chat with materials that the Vera Institute has developed, including on some specific situations in New York. And so you might want to take a look at that. I'll also note that I do think we'll probably have time for one or two questions when I'm done. And so if you've got a question, please get those to Tammy, and we'll try to get to one or two, and then if there are more, we'll respond afterwards. I want to bring this into the JCPA context. JCPA has two resolutions specific to criminal justice reform. One from 2015 and one from this past February. Combined, what they paint is a policy where we are seeking to have non-incarceration approaches to our crimes and to people who are convicted of crimes to the maximum extent possible. People who are committing drug offenses, the goal should be to treat them and to deal with the drug aspect of their situation, rather than putting them into a jail or a prison and having that just simply perpetuate and get worse. Other kinds of things where you have situations where people can be put into diversion programs. We've seen those in the Philadelphia area that have been presented to JCPA over time, where we're going into a form of employment training is a better alternative for people. So we've got good policies on a whole series of issues. Where we've had challenges, and I serve as JCPA's representative on a number of coalitions in the Washington context, and where we've had challenges in keeping up with our partners in the criminal justice reform area in the specific coronavirus context is where they have said we should be taking people out of jails and prisons who are within X months, 12 months of the conclusion of their sentence, who are over 60 years old, or who are suffer from underlying health conditions such that if they get the virus, they are going to be very much at risk for the lethal aspect of the virus. And as David Bohm has posted in the chat, being sentenced to a jail or prison it should not be a death sentence simply because of the facility that you're in. And so we're looking to join with our partners in making these advocacy, but we may not have quite the policy that we need in order to do this. And so that is where we want to dig down into the discussion during the 2 to 3 p.m. Eastern time part of this program, and see whether there is additional policy that we can formulate. We're not agreeing to anything today, but formulate to get out to people in the form of a follow-on resolution that may be specific to the coronavirus situation, and then may allow us to take another look at what happens afterwards. Once we've released, hopefully, a large percentage of the prison and jail population from incarceration, rather than simply putting them back when the emergency is over, do we take this as an opportunity to have some real change in policy and practice? In any event, Tammy, do we have a question or two?
We do, and I think we actually have time for questions. So the first one is actually about bail. And this person wants to know if Faye and Insha can address sort of the larger bail issue, but also bail as it relates specifically to the COVID-19 crisis and the overrepresentation of minorities and low-income individuals caught in the bail system.
Sure, I can start us off, and Faye, please jump in. My specialty is that I work on bail reform issues across the country, and have worked on legislation and work with judges and others across the country on helping develop better bail practices to end the use of money bail, and to make sure that as we do bail reform, that we're actually really thinking about prioritizing not only reducing the number of people in jail, but addressing the racial disparities that are compounded by the fact that we have a money bail system, as well as making sure that we decarcerate, have fewer people behind bars in a way that is responsible and safe and responsive to public safety needs. And so what we have actually seen, I mentioned when I talked, that we've seen a lot of really positive movement at the local jail level in terms of jails that have reduced their jail population by 25, 30, 40%. And most of that has actually been driven by different bail practices, because we know that the vast majority of people who are in jail are there because they're there pre-trial, they're there on a bail amount that they can't afford. The average bail on a felony in this country is a little over $10,000. Again, it varies widely from place to place. But what we also know from the Federal Reserve is that half of all Americans don't have $400 to cover an emergency, let alone $10,000. So that just puts into stark relief the challenges of having a money bail system. The other thing that I think a lot of people don't realize is not only do we have a money bail system, but we have a for-profit money bail system where bail bond agents are able to turn a profit off of somebody's misery. And we're actually unique as a country, America, in having a for-profit bail bond industry. We just assume the bail bond industry exists. We've always known things like Dog the Bounty Hunter, but we're actually one of 2 countries in this entire world, the other one being the Philippines, that has a money bail system that allows bail bond agents to turn a profit off of somebody's misery and crisis. So the work that's being done at the local level on bail reform has really gone into overdrive in some places in response to coronavirus, and that's a really welcome change. So for example, Houston, Texas, Harris County, which is a jurisdiction that I've been working in for the better part of 6 months to help the judges who are on the felony bench there create a new bail policy. Basically, we took 6 months worth of conversations and some hesitation and essentially moved it quickly for the judges to pass a policy where if somebody's arrested for one of 51 offenses, which is a significant chunk of the offenses that people are arrested for in Houston, or if anybody is currently in the jail on one of those offenses, they will be released in response to coronavirus, and there's a full commitment to keep that policy after as well. So it's not just about simply creating a policy, but also creating the apparatus that supports effective bail reform. And so what Harris County has done has also really beefed up pretrial services in this moment. And pretrial services is the services, it's exactly what it sounds like. If people are released pretrial, they can get the support to be reminded of their next court dates, especially in this moment, to make sure that when somebody leaves the jail that they have a place to go to and they have transportation to get there. And importantly as well in this moment, to make sure that people who are released from the jail, if they're showing any symptoms or if there's been an outbreak of coronavirus in the jail, that we are responsibly releasing people with medical isolation and testing to make sure that we're not inadvertently spreading the virus when we are releasing people. And that sort of momentum that we've seen in Harris County, that's literally reduced its jail population by 18% in 4 weeks, when it hadn't been able to move its jail population for years before that. We're seeing that kind of momentum happen across the country. The California judges issued a new bail policy saying people charged with certain offenses, again, won't set bail. We've seen judges here in New York City at Rikers Island reduce the jail population to the lowest it's been. Literally, the last time we had 4,000 people in jail in New York City was the 1950s. So we're seeing great momentum across the country. And as Bruce said, the effort now is to make sure that the places that remain untouched by these reforms actually get the memo and get the support they need. And that will come from local advocacy and efforts to sort of push. We're seeing less momentum in more rural parts of the country. And we know coronavirus it's gonna come there. It's just a little bit behind the pandemics that we've seen and the outbreaks we've seen in the cities. So we should all be focusing on more rural parts of the country, and how do we make sure that the jails there are actually thinking about bail reform and other methods to get people out. And then finally, as Bruce said, how do we make sure that some of the good gains that we've made in response to this crisis remain permanent, and they're not just, we don't go back to business as usual after, but that we take the best of these reforms and make sure that they stick.
Thank you, Insha. I think actually we got to the end of our time at this point. And so I'm going to invite those of you who are going to join us in the discussion later to bring all your questions and comments there. And those of you who are not joining that, please, by all means, be in touch with us either in the chat through this or by email afterwards. And so now I'm going to turn it over to Corey Shapiro for the next set of issues.
Thank you, Bruce, and thank you to our panelists. I first want to remind everybody about the Zoom protocol. You will be muted during the presentations. We encourage you to turn off your video and click on speakers view it's usually in the top right-hand corner of your screen. If you have any questions while the speakers on the next topic are speaking, please put them in a private chat to Tammy Gilden. The issue of elections and voting rights is right in the foreground of the pandemic, right in the foreground as the pandemic hit in the middle of our primary season, and is likely, and many public health experts expect that the impact will still be felt at the time of our November elections for the presidential and major elections around the country. Elections are the backbone of our democracy, and we must be aware and engaged on this concern. While JCPA has very strong policy on elections and voting rights, this time period is unique in our history. And therefore, I would like to introduce our speakers who will talk about voting rights and election policies. Our speaker is Hannah Freed, who is the director of All Voting is Local at the Leadership Conference on Civil and Human Rights, and Barbara Weinstein, associate director of the Religious Action Center on Reform Judaism. Hannah will need to leave early, a little early, so if you, so we will be answering your questions afterwards. Barbara and I will be able to answer any questions that you may have. Please, as a reminder, send your questions in a private chat to Tammy Gilden. And I'll leave it to Hannah. Thank you very much.
Hi, good afternoon. Thank you all so much for having me. I appreciate the opportunity to talk about what is happening on the voting front in light of the global pandemic, and also share some ways that folks on the line can participate. I do unfortunately have to get off early, but I'm very happy to continue to be a resource and take any questions that folks aren't able to answer after I have to hop off. I'll tell you a little bit first about All Voting is Local and the work we do at the Leadership Conference around voting, although many of you are familiar with the Leadership Conference and the work that it's done for many decades now on civil rights and on voting rights specifically. The work that the All Voting is Local campaign does is focused on fighting back against the needless and discriminatory barriers to the ballot that voters continue to face. And to do that before these problems become actual obstacles that prevent voters from making their voices heard. And we are at the Leadership Conference, we are also a collaborative campaign. We work in close partnership with 4 other national organizations, the ACLU, American Constitution Society, the Campaign Legal Center, and the Lawyers Committee for Civil Rights. In addition to that, we work with more than 50 in-state partners, long-time voting rights organizations, and also organizations that are newer to this space or that serve the communities that we also serve in contexts aside from voting. The work that we do day to day is focused on monitoring voter suppression problems, exposing them and preventing them, with a particular focus on historically disenfranchised communities. We have staff on the ground in Arizona, Ohio, Florida, Wisconsin, Georgia, Michigan, and Pennsylvania. The work that we do, people ask me this all the time, has it changed in light of COVID-19? And actually, I would say in a lot of ways it has not. What COVID-19 has done is surface these problems, shine a light on them, and make them all the more critical and acute. But I think, if you were watching what was happening in Wisconsin, if you were in Wisconsin, it probably did not surprise you to see the problems that Wisconsin voters were facing, particularly in some of the state's urban centers like Milwaukee, where voters waited for hours to cast a ballot. Let me talk a little bit about what happened in Wisconsin as an example of what voters and states are facing right now. What happened got a lot of coverage, so it may be familiar to you, but to give you some perspective that I can share from our staff on the ground. As folks probably saw, there were court decisions coming down in literally the hours before people were supposed to be voting, both at the state Supreme Court and the US Supreme Court level. What had happened there, and I'll also talk about Ohio, where we saw a similar kind of back and forth in the hours before that state's original primary date. There was quite a lot of back and forth that left voters very confused about what was actually going to happen on April 7th in Wisconsin. The governor extended deadlines to vote absentee, to cast a ballot by mail, relaxed one of the really burdensome requirements around voting absentee. That was then challenged in court and was subsequently reversed. So the election did go forward on April 7th. It went forward largely by mail, and poll workers who are so critical to running polling places pulled back because of the threat of COVID-19, and polling places subsequently closed. And so voters who were accustomed to registering in person, as you can in Wisconsin, voters who are accustomed to voting in person could not do that. And we saw significant shutdowns that made it very difficult to cast a ballot in person. Milwaukee, for example, which has a population of about 600,000, went from 180 to 5 polling locations. In Green Bay, we saw similar reductions, 31-2. Waukesha is a city that has 70,000 people and had only one polling location. The result of that was voters waiting for hours to vote. That was compounded by the fact that efforts to extend the vote by mail deadline were then walked back, including by the United States Supreme Court. And so voters had to get their ballots in postmarked by Election Day, and then they also were had to find another adult who could witness their ballot, an adult who could sign their ballot and say, you know, this person is who they say they are, a task that became for many voters who were complying with the state stay-at-home order impossible. And it was, you know, I will reflect, as I mentioned, what our folks on the ground were seeing. It was a terrifying situation for so many voters. Our state director, who is a longtime Milwaukee resident and activist, described a scene that was what she called Milwaukee's Selma. It was so, the fact that voters were forced to choose between their health and their right to vote is a situation that we cannot see replicated in November, and we should not see replicated anywhere else during their primaries. I'll briefly talk a little bit about what we're seeing in Ohio. As I mentioned, that state's primary was set to occur on the 17th of March and is now sort of being pushed until April 28th. And I say sort of because the consequence of a lot of court jockeying in court and also in the legislature and with election officials has been to result in a largely vote by mail, really almost entirely vote by mail election for the 28th. That means that almost nobody can actually vote in person, and voters have to vote by mail. Voters are not automatically getting a vote by mail ballot. They are not even automatically getting an application to get a ballot. Voters are getting a postcard that tells them that they should request an absentee ballot. They are then required to request it and get it mailed to them and send it back in time for it to count. That's asking a lot of people. I don't have a printer at home. I don't know how I would print out my ballot application if I were living in Ohio right now. It's these kinds of hurdles that mean that voters are not going to be able to cast a ballot. And what we are hearing from voters across the state is that their ballots are not coming, and despite their best efforts to get them. And I think what I really would like to, highlight about Ohio and about Wisconsin is it's not enough to say that you're moving to a vote by mail election. You really have to make those ballots available to people in a real way. And so what are the solutions here? I will say that, what we're seeing in Ohio and Wisconsin is deeply troubling, but these are solvable problems. And about a month ago, as COVID-19's impacts were really being understood for us as a country, but also on voting, hundreds of civil rights groups, about 200, signed on to a set of recommendations to ensure that every community can access the ballot this year, despite the threat posed by this pandemic. And since then, advocates across the states, across the country, have been driving those reforms forward. So what are those reforms? I talked about expanded vote by mail. It is a critical part of the response to COVID that people be able to vote by mail. That is a natural response to what is happening on the ground. If you cannot leave your house, it seems quite sensible to be able to vote by mail.
Jay, my computer is not.
But it's not enough for a state to simply say, we're going to do all vote by mail. What we have to see is a commitment from state officials to make that truly accessible for every voter. That means making it easy for people to request a mail-in ballot. A postcard telling people they should do it is not enough, right? People should be able, through one step, calling their local office, getting a ballot requesting a ballot online. Those are simple one-step processes that we should be seeing across the country to actually facilitate vote by mail. We want to also make it easy for people to return their ballots. Prepaid postage is one way to do that. Options to return your ballot, not by putting it in a mailbox, but by putting it in a drop box. That's another way you can make vote by mail accessible. And that's particularly important for communities that have legacy mistrust of government systems, for whom putting their ballot in the mail may feel just uncomfortable. And we want to make sure that people have confidence that their vote is going to count. We also want to see states relaxing highly technical rules about voting by mail that can result in ballots getting rejected for no good reason. There are arbitrary protocols that states use to decide, for example, if somebody's signature matches the one on file, and that can result in somebody's validly cast ballot getting rejected. A person whose signature has changed over time because of age or because of disability, that shouldn't be a reason for their vote not to count. And we also have seen in states like Florida that arbitrary rules like this lead to ballots being rejected for voters of color and for young people at higher rates. States need to change these rules so that a ballot isn't rejected for no good reason. We also want to see voters having multiple options to cast their ballot. If Wisconsin shows us anything about how people are voting right now, it's that some voters are always going to need an in-person option to vote. That is particularly true for voters with disabilities, non-English speakers, both of which communities may rely on an in-person voting option to get the assistance that they need to cast a ballot privately and securely. This is also true for voters who live in remote areas. Native American voters in Arizona, for example, where about 80% of people across the state cast their ballot by mail, but about 26% of Native American voters living in Arizona don't have access to a US Postal Service address, making it difficult, if not impossible, for those voters to cast a ballot by mail. So we need to have safe and sanitary in-person polling places and the option to cast a ballot in person without having to wait in an area that can be put a person at risk for contracting COVID-19. And that includes extending early voting periods for at least 2 weeks before Election Day, including weekends, so that people can follow social distancing protocols and we can ensure that long lines don't form when people need to take advantage of an in-person option to vote. Finally, the response to COVID-19 and some of the ways that states can improve their policies to ensure access right now aren't just about voting, it's also about registration. You have undoubtedly seen voter registration drives in your own community as a presidential election heats up. But social distancing means that those traditional voter registration drives that we see popping up all over the country are going to have to be on pause or significantly limited, at least right now. So voters are going to need to register through other means, and that includes online. About 38 states in the District of Columbia have an option to register to vote online, but that means there are still many states that don't. And so the remaining states need to implement online voter registration right now. And we also need to make sure that these systems are secure and stable enough to handle a major influx. A final thing I want to highlight that's less about policy and more about how states get it done is about voter education. Wisconsin and Ohio, and also other states that have had primaries like Florida and Arizona, voters reported significant rates of confusion and concern about their access to the ballot. States need to be making decisions right now about how to run their elections, but they also need to be making sure that they're communicating out those changes to voters transparently and meeting voters where they are. It's not enough to send voters mail right now.
Yeah, I just got on.
To tell them their election is changing. We also need to be making sure that voters are being reached by public service announcement on the radio, by text message, right? By email. There's so many ways to reach people now, and election officials need to be undertaking aggressive voter education campaigns to ensure that voters have the information they need to cast a ballot and that they have the confidence that their vote will count. So for you, what can you do? Couple of things. First, what we need to see is more funding for election administration. Congress has already dedicated some funds, but it's not enough to ensure that election officials across the country have the resources they need to do all this stuff that we're talking about right now. States are going to need an additional $3.5 billion to prepare for the primaries and for the general election. And also, we're going to need to have state-based advocacy so that we can ensure that all of these reforms are implemented effectively across the states. So if you're interested in engaging more, we of course will be able to stay in touch through this connection, but I also encourage you to go to andstillivote.org to sign up to become an advocate on these issues in your own community. We'll be following up through this call, but also through to people who sign up that way, so that you can become an advocate for this work and ensure that all communities in your state, in your area, have access to the ballot in 2020. Thank you. And again, I apologize for having to jump off, but I have a couple minutes for questions if that's the appropriate time on the agenda.
I think we have one question in the chat room that's, how can we push for...
Is Barb speaking now?
Oh, yes, thank you. We cannot answer those questions. We'll let Hannah go. Thank you so much, Hannah. That was so informative, and thank you so much for the work you do and your organization does. It is incredibly important work. And I'm going to turn this over now to Barbara Weinstein from the RAC, who will talk about the work that she is doing and her organization is doing.
Great. Thank you so much, Corey. And I just want to echo the thanks to Hannah, who is just one of our most valued partners. And I think we all on the Zoom can see why right now. Hannah just outlined a whole range of ways the integrity of our electoral system is being challenged right now, and some things that we can be doing. And I want to just take a few minutes to put a bit of our uniquely Jewish spin on the conversation. Now, the nice thing about being on a Zoom where we're actually encouraged to keep our cameras off is that maybe like one or two of you on the Zoom, I just ate lunch. And less than a week after Passover, I'm still getting a little extra enjoyment out of eating all the chametz I can, like the bagel I just had. And I know, a lot of things about Passover changed. My chametz consumption, not quite so much, but Passover was, like for so many of us, really different this year. And I did a Zoom Seder, certainly not unique in that, but in a typical year, so many of us gather around in big groups around our Seder table as we retell the story of our liberation from Egypt. And that's just one example of Judaism's emblematic emphasis on the communal, right? We begin our minyan when we've got 10 people present. We think back to how Abraham went out to welcome guests into his tent. And today we kind of relive that experience when we welcome Ushpizin into our Sukkot. And on Yom Kippur, the holiest day of our year, we atone for our sins in the plural, right? We have slandered, we have deceived, we have gone astray. It's not about the individual, it's about how we behave as a collective and how our actions reflect on the collective. We really understand that our own well-being and our future is bound up in that collective. And what better example could there be than what we are all living through right now, when we are making individual choices about our behavior to stay home at the top of the list and deny ourselves so that the collective can be healthier and hopefully protected. And these are lessons, that have gone throughout the centuries and that our Jewish sages have been teaching back to our earliest days, right? In Pirkei Avot, we read Hillel's admonition, do not separate yourself from the community. And it's why our community today continues to come together across denominations and agencies and organizations, election cycle after election cycle, to encourage nonpartisan engagement. We know in our kishkas that democracy is strongest when everyone has the opportunity to participate. And those lessons have really been integral into our community. They're reflected in the traditionally high rates of voting that we see across Jewish voters and across the decades, right? Voting in the general population hasn't cracked 60% in a general election since the late 60s. But Jewish voting consistently, election after election, is in the mid to high 80s, sometimes even in the 90% range. It reminds us of the words from Rabbi Yitzchak in the Talmud that a ruler is not to be appointed until the community is first consulted. And the current situation that we're in shows just how important wise and capable leaders are at all levels, right? We're all looking to our mayors and our governors and our members of Congress and the president for leadership in this moment. And each of us knows that we have unique responsibilities because we're all sitting on this Zoom as members of or representatives of Jewish organizations and institutions. Most of us, if not all of us, are 501c3 organizations. And with that benefit, that tax-exempt status, we know we have an obligation to remain nonpartisan. But we also have the absolute right, and I would even say the responsibility, to encourage participation and turnout in election seasons. So let me just make that really, really clear. As 501c3s, we are barred from endorsing or opposing candidates or parties for office. But we can absolutely speak about issues, endorse ballot initiatives, register people to vote, volunteer as poll workers, and help protect people's access to the polls on election day. In the reform movement, we're encouraging our congregations to pledge to be 100% voting congregations. Everyone eligible to turn out to vote should pledge to do so and show up on election day. And we're giving our congregants the tools to organize in their congregations and their communities to combat voter suppression, some of the things that Hannah just described, and to do get out the vote efforts like reminding people to register or driving them to the polls on election day, or speaking out for universal access and voter participation. We're even doing student-led peer-to-peer voter registration and pre-registration with direct outreach to high school communities. So even to communities that aren't yet themselves old enough to vote, they can still play a role in making sure that others are registered and turning out on election day. So we do this work as Jews, but we also know how vital it is, as in so much that we do, to work across lines of difference, whether that's faith, race, class, geography. So look around your own community. Look to the League of Women Voters or a local church. 2 years ago, the last election cycle, we had congregants in synagogues across the country calling Florida voters to get out the vote for Amendment 4 that restored the right to vote for formerly incarcerated individuals. And we weren't alone in that. I know there's lots of organizations, NCJW and others that are on this call that were in the lead in doing that work as well. So geography also should not be a barrier to doing this work in a nonpartisan way. And in these unprecedented times, staying home isn't even a barrier, because we all know how easy it is now through social media, through cell phones, etc., to reach out to our friends and even people that we don't know who live in other communities. So if you're looking for more ideas, I know JCPA will be sharing them, and I also invite you to join us on May 7th for a town hall that as we launch our own civic engagement campaign, which we're calling Every Voice, Every Vote. If you're looking for more info, you can go to rac.org/townhall. And with that, I will close and just say how much I'm looking forward to doing this work together with everyone here. Thanks so much.
Thanks
we
so much,
We have a
Barbara.
couple minutes for questions. Oh, sorry, Corey, go ahead.
No, I was just going to thank Barbara so much for providing that presentation. And I think we have a few questions from the assembly. So Tammy, if you want to go ahead and let us know what those are.
Absolutely. So the first question is, this was directed at Hannah, but Corey, you may be able to answer this as well. If you could comment on the shortfall for the post office and whether this is part of a scheme to impair vote by mail elections.
I don't know whether there is a scheme to shortfall the shortfall is a scheme to limit prepaid postage, but I do think it's important that people have an opportunity to return their ballot without, especially in the pandemic, without having to worry about finding a stamp, getting a stamp, going to their post office, getting a stamp. There are many people who won't be able to return their ballot. And so it's really critical that when the states are looking at ways to change their procedures in light of the pandemic, that there is ample opportunity and different ways that folks can return their ballots. So one way is prepaid postage on all ballots. The other way is you're seeing some states do things like secure ballot boxes. So they'll put out sort of a box that people can just drop it off into that box that's secure. Sometimes they're at the county, the clerk's office, or wherever it is that people might go to vote in person on an early voting, wherever the election officials are for their county. And so those are different ways, but it's really critical that states provide some sort of an option that does not require people to put a stamp on their ballot. Barbara, I don't know if you have anything else to add.
No, I would just add, one of the things we're making sure not to do is limit the options, because today it's, vote by mail. Tomorrow, maybe it's vote by the internet. Maybe next cycle it's vote by hologram. We don't know where this is going to go. So we want to make sure that, for us anyway, the bottom line is that elections are safe, fair, and accessible.
Great. So the next question is, what are the best ways to push for these reforms? This person says online voting options, but I think they mean sort of online registration and facilitating voting through the internet.
I can take a crack at it, and if Corey, you have anything to add, of course. The first thing to know is that election law is really set state by state. So while there's an important role for Congress to play around providing funds for election, or even restoring some of the voting protections that were decimated by the 2013 Shelby v. Holder decision that really undermined the Voting Rights Act, this is very much work with your local board of elections, work with your local state officials effort. So though that would be the first place that I would direct everyone to figure out what the challenges are in your state that are unique to you, and work with officials that are closest to home.
Great. And again, this one was mostly for Hannah, but I think you guys might be able to answer. And that is, lots of people are wary of mail voting or mail-in ballots because they believe it encourages voter fraud. Is there a place to get reliable data about voter fraud? And I would just remind folks that Oregon has had vote by mail options for decades and has seen no increase in voter fraud.
I would say one of the most reputable sources is the Brennan Center. They have a whole project around voting integrity, election reform, and they're just an absolutely stellar source for great information that'll help answer questions about voter fraud, whether it's about mail or voter ID. That's another red herring. So I would send the Brennan Center, and I'll type that in the chat box for everyone as well.
And this was touched on earlier, but would drop-off options be allowed for ballots under a vote by mail election?
I think yes. I don't know exactly which states are offering that, but I know there are states that are offering it. I know here in Kentucky they're considering offering it as an option for the upcoming. There's a June primary here in Kentucky, and I know that that's something that they're considering here.
And I believe that's it for questions for you both. And for those that we didn't ask that are addressed specifically to Hannah, we'll get back to you with answers. We'll connect with all of the speakers.
Well, thank you so much to our presenters. I look forward to seeing those who are interested in our discussion in the breakout sessions. And I'm now going to turn the program over to David Bohm.
Thank you, Corey, and thanks to all of our speakers and presenters so far. I want to remind everyone of the Zoom protocol. Please mute yourself during the presentations. We encourage you to also turn off your video and click on speaker's view on your screen. If you have any questions while our presenters are speaking, please put them in a private chat to Tammy Gilden. So we're now going to be talking about decriminalization of border crossing by undocumented individuals and compassionate release from detention, immigration detention. JCPA has robust policy on immigration reform, but the issues that have arisen of treatment of migrants, immigrants, and asylum seekers was hard to imagine. Over the past 2 years, JCPA has gotten more involved in this concern, and the current pandemic is truly a worst-case scenario. In this session, we're going to look at issues related to criminalization, detention, and the work of ICE, especially during this period. There are a number of human rights concerns that JCPA is being asked to take positions on with our Jewish and non-Jewish partners in the coalitions with which we work. Our speakers are Sue Kenny Platzer, Highest Director of Border and Asylum Network, and Paramita Shaw, Executive Director at Just Futures Law. HIAS has recently opened offices on the border and in Mexico, extending their traditional work to meet today's current needs. And Paramita's organization, Just Futures Law, is also new, intended to strengthen the advocacy on the treatment of this population. If you have questions, again, please send them privately to Tammy Gilden in the chat box. And with that, Paramita, I'm going to turn this over to you.
Thanks so much. I'm really excited to be here, and I'm sorry that I may have to rush through this. Of course, like in the middle of the pandemic, we somehow, our whole blog lost its power, and so I'm gonna may have to switch and jump by phone in the next 20 minutes or so, but just wanted you to know that that could happen. But again, thank you so much for having me on. You know, I've been in the field of immigrants' rights for about 20 years, and
I think we're having some
at this
audio
intersection.
issues.
Oh,
Do
are
you think
you?
you could call in by phone?
It might be easier, right? Okay. Can you hear me now?
Yes, we can hear you. Go ahead.
Okay. All right. Let me know if the quality gets worse. I try to get on by phone at the same time. Sorry about this, everybody. So basically what I wanted to say was that, you know, while the country continues its decades-long wait for immigration reform, our administration continues to warp the powers of the executive to find ways to break up immigrant families, dehumanize and criminalize immigrants, and expand the immigrant deportation and detention machine. Can y'all hear me still? Is that a yes?
Yes, we can hear you.
Okay. Primarily run by private for-profit companies. And so I just wanted to put down some baseline immigration information for you all, which was that DHS is still a 16-year-old agency, but one of the largest in our federal government. It includes FEMA, SSS, and Secret Service, and so many others, but the bulk is immigration enforcement. A couple of things is that anyone who is a non-citizen can be deported. And that means if you're a green card holder for 30, 40 years, you can be deported. And usually my career has seen most of that happen as legal residents are permanently separated from their loved ones. Often because of contact with law enforcement, criminalization, and our mass incarceration system. Everything from a marijuana offense can trigger deportation. I have seen people deported for stealing hubcaps of cars. I've seen people who have been deported who've been here for 50 years for having fights on the streets. So criminalization has a massive impact on immigration. And it really comes to this, and I think Michelle Alexander, who wrote The New Jim Crow, did this really well when she said, you know, she really has begun connecting the story of immigration with the story of criminal justice reform. Mass deportation and mass criminalization walk hand in hand. And as 2 million people sit in jails and prisons at this moment, 1 million people are removed from the United States every year. It is important to remember, and this is my work, and so I have very strong feelings and passionate feelings about this, is that felons have families and criminals are often children and teenagers. And in the notion that you could be permanently disposed, that you could be deported or exiled from your loved ones is something that has rationalized mass incarceration in the United States for many, many years. And so this is why, you know, most of my career has been spent doing this ever since I was a legal aid attorney to working in detention systems in the United States as a detention project attorney. At this time, the DACA decision is coming down any week. It could come down next week. We know that ICE is not releasing people from prison, even though we have a COVID crisis. And COVID is taking off in our prisons. At this moment, we have about 100 people, including people who run those jails, who are infected with COVID. And at the same time as these bills are coming down, many immigrants are excluded from benefits. Many immigrants are not going to see the benefit of the paycheck, are not going to see money come to their businesses, are not going to see the benefits of soap and clean clothes and sanitary products being delivered in their jail system. These are not the benefits that all these COVID bills are going to give people in detention and on the streets. And so with that, I kind of wanted to launch into a couple of things which I've been asked to talk to. One is about raids, which are still continuing in the United States, and they are continuing now. So even though the administration has said that they are backing off some raids, we still do have pictures and have seen ICE officers in hospital rooms, restaurants, in homes. In fact, on the very first day of California's shelter-in-place crack lockdown, ICE was raiding immigrant communities in Los Angeles. And to give you a sense of what that could look like, I do have a picture that I did want to share with you, at this moment. I don't know if I can do that. Oh, I can't do it. But we have pictures of ICE carrying, massive guns, looking through the peephole without uniforms often, with very confusing uniforms that say ICE and police. Nobody really knows when people come and raid, who is actually raiding them and why are they coming. And it is very confusing when all you see outside your door is somebody with an assault rifle and really no uniform, but it says police or HSI, and it's very confusing to know that that person could be an ICE agent. And I think what's ironic in this moment is even though ICE agents are carrying N95 medical masks to protect themselves from COVID-19, they did break state regulations that ordered everyone to stay home, except to do essential activities. And I think it raises the question of whether raids really are essential activities at this moment in time. ICE raids, by all accounts, have become more violent and more militarized. ICE is one of the largest law enforcement agencies in the United States that operates largely without accountability. It doesn't even have the kind of police review process that you might even have an NYPD. And it does have, between ICE and Customs and Border Protection, you are looking at over 100,000 agents who are armed with and authorized to carry guns. And so we're kind of coming off the end of a time when the raids were ramping up. A person in Brooklyn was shot in the face by an ICE officer who raided someone at their home who was another target, a boyfriend of someone else, but then shot another person while he was there. We are coming off the time when we were the Mississippi raids in August of 2019, the largest workplace raid of all time, where about 700 people were arrested, where they called it a criminal immigration raid. And those immigrants were largely left out of those benefits and of getting to be with their families, where you could see children at home separated from their parents, not knowing where they were going. And so as COVID also expands in meatpacking industries, we know of 300 cases, for example, in Pennsylvania. Immigrants are particularly vulnerable, not only to exploitation in these workers' businesses, but also to COVID, because they will not get the same kind of access that so many US citizens have. And so with that, when you look at some of the charts that ICE is sharing, they claim that detention numbers are going down. And what I really wanted to share was that ICE detention numbers are not going down. Even though raids may be slowing down, the fact is that they are not releasing people, and there is a need to release people from jails and prisons because there is no social distancing in jails and prisons. There's no social distancing amongst families who are detained in the Berks Detention Center or any other places like that. But with that, I really wanted to get to the issue of family separation and the issue of why our organization and so many others have called for an end to migrant prosecutions and the decriminalization of border crossings. As you might know, that in 2018, over 2,500 children were separated from their families. Over 1,000 of them were under the age of 10. And many more of those families continue to remain detained in places like Texas, California, Pennsylvania, so many others. Illegal entry, which is a federal crime, and illegal reentry, which is also a federal crime, they carry sentences. The first one, 1325, carries a sentence of about 6 months, and 1326 can carry a sentence of about 20 years. They are the most prosecuted federal offenses in the United States. In the past 2 decades, it accounts for 48% of the growth of total convictions in federal courts. We spend millions of dollars each year on U.S. Marshal Services and the Bureau of Prison Breaks that holds these people who are being prosecuted for illegal reentry or illegal entry. The way that it looks like sometimes, and if you go to Tucson or if you go to many of these courts in Arizona, you can see what it looks like, which is that it is about people standing in line. They rarely have spoken to their attorney. They are prosecuted en masse. They agree to a sentence en masse in front of a judge. It is not clear whether they understand what is being told to them or what is happening. And the reason why this all happened was that the Trump administration made the choice to implement these existing regulations in an extreme way. And they did it by capitalizing off these kinds of offenses, 1325 and 1326 migrant prosecution offenses, which actually are offenses that came out in 1929, offenses that are the legacy of segregation and white supremacy, a law that was written by Senator Blease from South Carolina, who wanted to ensure that Mexicans do not come any longer into the United States. And so when they were trying to address the Mexican problem, they enacted these statutes, migrant prosecution statutes. And that is why,
could you please wrap up?
In this new time, that migrant prosecution certainly should be decriminalized and they should be ended. Thanks.
Thank you. We're going to go ahead now and hear from Sue Kenny-Platzer from HIAS.
Hi, it's actually Sue Kenny-Falzer. It was spelled wrong on the agenda. That's okay.
My apologies.
No worries. It's a difficult name. So yes, I'm the director of Border and Asylum Network at HIAS. For those of you who don't know much about HIAS, HIAS has for years provided critical legal and immigration services for refugees and asylum seekers. We're a national advocacy leader. We've engaged many thousands of people in the Jewish community and beyond to take action with the goal of restoring U.S. refugee admissions program and ensuring that asylum seekers have access to a fair, humane asylum process. We've offered legal representation to asylum seekers from our New York City offices for decades. And now in our new headquarters in Silver Spring, we've been providing direct representation since 2015. But we realized during the summer of 2018 that we needed to become active on the southern border of the United States when we were seeing what was happening. So we started by conducting a needs assessment on both sides of the border that summer. And we started organizing delegations of pro bono attorneys to travel to the family detention centers, such as Dilley and Carnes, to spend a week assisting asylum seekers there in conjunction with the organizations that work at those detention facilities. And then our border work really started in earnest with our HIAS Border Fellows Project. It started in October of 2018. And the HIAS Border Fellows Project is one by which the fellows are attorneys or accredited representatives, which is non-attorneys that are essentially given permission by the Department of Justice to provide legal immigration services. So the fellows are attorneys or representatives who are embedded with local legal service organizations along the border, nonprofit organizations. We started with just 3 fellows and we've now expanded to 6. We have 2 fellows in San Diego that are with the Jewish Family Services of San Diego. We have 3 in El Paso. One's with Las Americas Immigrant Advocacy Center, one with DMRS, Diocesan Migrant and Refugee Services, and then our newest one in El Paso is with EPIC, the El Paso Immigration Collaborative. And we have a brand new fellow that just started this week in Brownsville, Texas, with ProBar, which is an initiative of the American Bar Association. So our model is to partner with local organizations on the ground there to fund a fellow, and then HIAS also provides oversight and coordination, training, technical assistance, and also our large policy and advocacy departments, communications, community engagement. Through those departments, we're able to lift up the local stories to a national audience, as well as to the Hill to advocate with Congress and the administration. We then opened offices in Mexico on the Mexican side of the border, starting in August 2019, funded by UNHCR, the United Nations High Commissioner for Refugees in Mexico. So we started with our office in Ciudad Juarez, and we expanded. So Ciudad Juarez was in October 2019. We expanded into offices in Tijuana, Mexicali, and Monterrey in early 2020. So all of those offices are now open. We are now going to also even have some staff in Matamoros, although we won't have an office, but we'll have some staff there. So in these Mexican offices, they're staffed by Mexican lawyers and paralegals. They provide Know Your Rights presentations. They receive training from us at HIAS headquarters so they can understand the basics of US asylum law, so they can provide Know Your Rights presentations to the migrants, and then do one-on-one intakes and screenings. And then we are able to take the appropriate cases and refer them on to US partners, such as our border fellows, to then represent those people in their asylum claims. Because I don't know how much you know about the Remain in Mexico program, but the people are forced to wait in Mexico while their cases are pending in the United States. So this really requires cross-border collaboration, and HIAS has been doing that by having the fellows on the US side and now our Mexico offices on the Mexican side, and they really work together. Also, if people choose to not seek asylum in the United States, perhaps they realize they don't have a strong claim or whatever other reasons, our Mexican attorneys can then represent them to seek asylum in Mexico instead if they wish. Our offices in Mexico are also about to start offering services for survivors of gender-based violence, as well as mental health and psychosocial support. So they'll be able to provide more wraparound services. We also, HIAS also started a border response team in El Paso, Juarez in September of 2019. And that's where a project whereby non-attorney volunteers can spend a week. They stay in El Paso and they travel into Juarez every day, walking across the bridge, and work with our staff in our Mexico office in Juarez to meet with individual asylum seekers to do screenings so that we can then make that next step of referring them on as appropriate. They also provide some translation and interpretation services. Of course, during COVID, this is all being done remotely now, but that was the model that was set up. We also have some pro bono attorney programs that have always been remote, and that is a remote pro bono representation project for people in the Remain in Mexico program, whereby we, because there's not enough fellows or not enough attorney partners on the US side of the border to take all of the cases that need representation, we recruit pro bono attorneys across the country to take the cases and represent them remotely. Was someone trying to talk? Okay, I'm almost done. We also have a pro bono appeals project whereby we have remote pro bonos across the US that HIAS mentors to represent asylum seekers in their appeals before the Board of Immigration Appeals. We've created 2 videos, recently animated videos for asylum seekers. One is about asylum in general and the MPP program, the Remain in Mexico program. And then another one is a a video specifically about 2 new programs that are being implemented at the border that are basically rapid deportation machines. I won't get into the details of that, but we've been creating these videos. They're on the highest YouTube site if you want to go to YouTube. And finally, we've been working on building an asylum network across the US so that once people are able to leave the border, either after they're released from detention or perhaps they get lucky and don't have to be in detention at all, and they go to join their friends and family across the US. We're working on building a network of wraparound service providers throughout the US that can serve these asylum seekers, not only with full legal representation of their asylum cases, but also wraparound services, case management, employment preparation, and the like. We're starting that with the Carolina Refugee Resettlement Agency, which is one of HIAS's refugee resettlement partners in Charlotte, North Carolina. So as soon as COVID's over, we hope to get that up and running, and we're gonna be expanding from there. So I'll stop there.
Thank you. And with that, Tammy, do we have any questions for Sue and Paramita?
Yeah, I think this one's mostly for Paramita, but can you talk more about the interior enforcement throughout the United States and the issues that it raises around internal checkpoints? You mentioned ICE raids and deportations, but you know, what kind of barriers does this raise for people in border communities, especially immigrants, related to the COVID-19 crisis? Do we still have Paramita? Are you still on? Oh, it looks like Paramita maybe has lost power. So in that case, I don't think we have any questions for HIAS.
Actually, someone sent me a private question.
Oh, great. Okay.
That says, can you talk about the policies and what you are seeing and not about your office? I mean, I was asked specifically to talk about HIAS's programs, and so that's why I didn't speak generally about what's happening at the border. Of course, I have lots I could say about that. There's a lot of terrible things going on, but I'll leave that up to JCPA in terms of what you would like me to say and answer that question.
Yes, I think we would love to know what you're seeing and particularly why HIAS has chosen to expand its border work.
Well, we didn't have any border work before the summer of 2018. So it was really this family separation crisis that summer that really just gave us the impetus that, you know, this isn't our mission. We really need to be doing something. And so we started, as I said, with that assessment and trying to figure out how we could make the best use of what we could bring to the situation. And it turned out that the HIAS Border Fellows Project was really a good way to do that. And it's really grown and provided a lot of help. I mean, as far as the border policies, I scarcely know where to start, but everything has been changing. I mean, since we started the Fellows Program in 2018 to now, completely different set of laws or regulations governing border policies. You know, the introduction of the Remain in Mexico program happened during that time, in which case we had to shift how we were operating, because before that we were focusing on mostly border detention facilities. Now we have the issue where the border is essentially completely shut, not essentially, it is completely shut down. For all these people coming to the border right now, they are turned around and they are told they will not get access to the United States. If people try to cross on their own, as what we call entering without inspection or entering between ports of entry, and they're captured, they then are either deported back to their home countries, they're taken straight to an airfield and put on a plane, or they're again sent back to Mexico. Very quick turnaround. So it's really the concept of non-refoulement, which started with the well, it's embodied in the Refugee Act of 1980 and U.S. law, and it's part of international law and our treaties. But what that means is you should not return a person to a country where they fear persecution, and the United States is doing exactly that. I see that Paramita has joined us again, so I don't know if you want to direct.
Yes, let me re-ask the question. So Paramita, can you speak more about the issue of interior enforcement and the specific issues it raises for border communities and for immigrants. You know, you've talked about deportation and ICE raids, but maybe talk a little bit about the internal checkpoints and sort of other enforcement mechanisms.
And just so I'll race just in case I get disconnected again, but you should look at the border as a 100-mile constitution-free zone. And so checkpoints are extremely common. And if you talk to border communities, as many of us has, they are over-policed and over-surveilled.
I think we lost her again.
Yeah, I think we did. Sue, can you talk at all about the need to expand or extend the TPS program?
TPS is not something that I am particularly involved in. That's not a border issue per se. So I don't think
I can
I
answer
could add
that
much.
if
Okay,
you want.
great.
Yeah, sure. So the TPS program is temporary protective status. It's a temporary program, although for many people, they end up living in the United States for decades, building families, they have careers, but they're essentially granted this status because there has been some kind of disaster, or in many cases it's a war, and they've been allowed to remain in the United States for a certain period. And what we've seen under this administration, you know, in a break with President, is not renewing or not extending TPS protection. So people, again, who've been living here for decades, many of whom have US citizen family members, including US citizen children, are now being a target of enforcement. And again, these are not people who have done anything wrong, and they've lived here for decades because it's unsafe for them to return home. And so that's an issue that JCPA and many of our coalitions are working on. And we've successfully pushed for the extension of many of the TPS programs for different countries, but that's something that is an ongoing concern.
Okay, Tammy,
Yeah, sure, go ahead.
do we have any other questions at this point?
So we have one more, but it's I think it's mostly for Paramita. What I think we can do, since we have a little bit of extra time here, is open it up for questions for any of the speakers who have presented today, if they're still on. So folks can put those in the chat to me, or if any of the speakers want to turn on their mics and videos so that we know you're here, that would be great. So we got, so now that we have Bruce and Faye back on the phone, one of the questions that we didn't have time to address was, how can we ensure re-entry support for those who are released from prison and jails, especially if we see sort of a mass release? And, you know, since homeless shelters are no longer taking new residents, what are the options for people coming out of prison and jail?
So let me begin with the concept of mass release. So first of all, for a person to be released, there still has to be a process that the prison uses in order to do that. Usually, if the state has some sort of parole board, the documentation would go through that parole board. That day one, someone unlocks the keys, a massive number of people show up. There usually, you know, is a much more thorough review of that person's background or what happened during their period of incarceration, and then where they are to be released to. So it's during that process of where they are released to that hopefully there will be attention to what's the housing situation for that person, how likely is that person to return to, you know, a community that is congested, and whether or not a person needs another place to live. Of which, you know, which we indicated in the question and answers before, that there are quite a number of places who are now using hotels, dorm rooms from colleges and other, readily available because of the isolation that we're all engaged in, places that we didn't have access to before. So there are more housing options potentially available. Of course, this means that, if we place someone in those housing situations, when we resume back to life pre-COVID, we're going to have to begin to think about the situation for that particular, but that is another hurdle that we'll get to when we're in that part of planning for, life after COVID. But so I think what's most important is there are processes set up. They're not great. Obviously, there's been a lot of focus on reentry and thinking through reentry. But here we're looking much more simply than we had to before. We're looking at housing and we're looking at basic human needs, food, clothing, housing, and not the full extensiveness of employment and social, social supports and things of that nature. So I think it's a little bit different now. And also we have access to far more resources. That varies by community, of course.
So I think if folks
Sue?
have questions that they have not sent to me in the chat, you're welcome to turn on your video and unmute yourself and ask those questions.
Amy, I've got a couple from the general chat that I'm going to go ahead and ask. Sue, what might be the immediate first steps a new administration will take to improve conditions on the ground border?
Yeah, the very first thing they can do is end the MPP program, Migrant Protection Protocols, which is the term used for the Remain in Mexico policy. End that program right off the bat, allow people that want to ask for asylum to enter the United States as they had pre-Trump, and use alternatives to detention models such as ankle bracelets if necessary, but even just community monitoring and check-ins have proven to be successful. So that would be number one. Also, the various harmful policies and regulations that have been implemented under Trump, such as the asylum bans and the transit bans. For example, the transit ban could be immediately revoked, which says that if an asylum seeker didn't ask for asylum and was denied in any country they traveled through on their way to the border, then they can't ask for asylum in the United States. That's referred to as the transit ban, and it's awful, and it's denying asylum to hundreds of people. They can just revoke that with the swipe of a pen. So there's lots of things that can be done immediately.
Okay, there's another question for the voting rights speakers. And that question is, how can CRCs and federations get involved in voting rights to ensure that everyone has the opportunity to vote?
So I would say, know that you don't have to do this work alone. And there are organizations both nationally and in your state and community that have this expertise. So whether that's a local organization like the League of Women Voters, or joining up with the Leadership Conference on Civil Rights, where Hannah works and has programs in states nationwide, look for those partners. NAACP is another great partner. Just make sure that anyone you reach out to is also a 501c3 organization, because they're going to be working within the same parameters that you need to work with as well.
And I'll add from Aryeh Leibowitz, who heads up the Jewish Labor Council, sorry, I'll turn on my video, that their central labor councils all around the country are ready and waiting to work with JCRCs across the country to step up voting rights work, whether it's voter registration, voter education. They have local chapters and branches almost everywhere that there's a JCRC. So if that's something you're interested in, please let me know and I can connect you.
And I would also add, in addition, you can always do get out the vote campaigns to make sure every single one of your members of your federation vote. That's certainly something that can be done. The other, another thing that people can be put in touch with are, in a lot of the states, there's election protection work. And so for people who are lawyers or want to be lawyers, there's plenty of volunteer work that's needed in those instances. And you don't have to be a lawyer in many of those cases in many of those states to do this work. It's just sort of a lot of fielding phone calls about people who are having issues with voting rights. And so there's usually a coalition of organizations in many states that do that type of work.
And JCPA is working on putting out an election guide. We're hoping to have that in the next month or so, hopefully sooner. That'll have some of these resources, and we'll expand on the different ways that GCRCs can get involved.
Thank you. So Corey, I'm going to go ahead and turn it over to you.
Great. Thank you all for attending the education part of the Delegates Assembly. And thank you so much to all of the great speakers and this conversation. This was put together in a very short amount of time, and we got some amazing speakers, and you all prepared for this, and we are extremely grateful for that. We also know that so many of you who are attending are feeling overwhelmed with all this work and the dire needs of the Jewish community, but I am so proud of the work that we have been doing in the community relations field that keeps us involved in building a fair and just America, and that engages closely with our faith, other diverse partners, other racial groups, to address the major concerns before us. I will turn the program over now to Susan Abravanel, who will give instructions on the deliberation part of the program, and then we'll take a short break. I also want to thank those of you who are leaving the session at this time, and know we really appreciate your participation in this, and look forward to seeing all the great work you're going to bring back to your communities and take on and do following this event. Thank you again so much for participating.